Good morning, good afternoon, or good evening, depending on where in the world you're joining us for today's event, the role of the private sector in advancing self-care. And I would like to invite you to please introduce yourself in the chat box by entering your name, affiliation, country of residence, and share briefly why you joined us today. Today's event is sponsored by the Self-Care Trailblazer Group, Global Advocacy and Communication Working Group, and the Reproductive Health Supplies Coalition Market Development Approaches Working Group. I am Sarah Malaba. I'm a seasoned public health practitioner with 20 years of experience in designing and executing large, complex, multi-funded public health interventions in Africa. Since February of 2021, I've led the Strengthening HIV Self-Testing in the Private Sector project, we call it SHIPS, at the Population Services International. The SHIPS project is a 3-year CIF-funded project implemented in Kenya, Nigeria, and Uganda that aims to grow the private sector market for HIV self-testing with a public health impact. The project is currently in the pilot phase, following its market research that revealed barriers and facilitators to the uptake of HIV self-testing in the private sector, and the success is leveraging public-private partnerships to advance HIV self-care. I will be your moderator for this important conversation today, and I'm excited to be with you to explore how the different experiences and perspectives of our panelists can help shine light on ways that the private sector can and should contribute to the health system and universal health coverage. We know that the private health sector plays an essential role in all areas related to health. In most countries, private pharmacies play an instrumental role in people receiving access to health products. The private sector also develops, manufactures, and distributes the self-care products that we use. The aim of today's discussion is to explore the relationship between the private sector and the health system and how they can better advance self-care products. We want you to leave this conversation with a better understanding of the role the private sector plays in advancing self-care and how we can advance self-care within universal health coverage. We have an engaging panel discussion with representatives from the private sector and a Ministry of Health official who will share how they were able to advance their self-care products with other private sector stakeholders. We have a lot of people registered for this event from every region, actually more than 600 people registered for this event. And again, I want to invite you to please introduce yourself in the chat box by entering your name, affiliation, country of residence, and also share with us briefly why you joined today. We want to hear from you throughout this meeting. And as we begin this discussion, please share your questions in the chat. We'll be collecting this throughout the chat and try to ask our panelists as many questions as possible. So I want to invite you to please engage. Okay, so let me take a few minutes to share with you a brief background on our two organizations. For those of you who aren't familiar with the Self-Care Trailblazer Group, we're a global coalition consisting of hundreds of members across more than 65 countries that is dedicated to expanding the safe and effective practice of self-care. Please join us if you aren't already a member. We have put the registration form in the chat box, and I'm asking my team to please enable the chat. I can see some comments that some participants are not able to access the chat box. Next slide, please. I'm going to take you through the mission of the Reproductive Health Services Coalition, which is also a global partnership of over 550 public, private, and non-governmental organizations dedicated to ensuring that all people in low and middle income countries can access and use affordable health, high quality supplies to ensure their better reproductive health. We always welcome new organizational members. And again, we are placing the link of this organization in the chat box. We're placing the link for your organization to join the coalition in the chat. We're also putting the link for individuals to join our working groups or caucuses there. Next slide, please. So as we start, let me go over some few ground rules, actually just two, to ensure that we all get the maximum benefit of today's meeting. So one, of course, we're inviting you to participate, share your thoughts, your views, and questions in the chat box, taking care to be respectful to each other. And then two, this is a space where all ideas and inputs are very much welcome. Next slide, please. So let me take this chance to introduce our three panelists. Today, we are joined by Jacqueline Ann Maimin, who graduated with distinction from the Rhodes University and is a pharmacist with 35 years working experience in the health sector, specifically in the pharmaceutical industry. Jackie is a past chairman of Western Cape branch of the Pharmaceutical Society of South Africa and is a fellow of the PSSA. She's an elected member of the South African Pharmacy Council, serving her second term where she chairs the practice committee. Jackie was a founding director of the Independent Community Pharmacy Association, ICPA, and is currently their CEO. Jackie believes that community pharmacy is ideally positioned to positively contribute to the health and well-being of the people of South Africa and will be a critical primary care provider under NHI. Welcome, Jackie. Next is Brian Reid of OraSure. Brian Reid is an international vice president at OraSure Technologies, responsible for the company's global infectious disease businesses outside the USA. He has over 40 years commercial experience in the in vitro diagnostic sector, having worked with a number of leading diagnostic companies before joining OraSure Technologies 14 years ago. At OraSure, he developed the OraQuick HIV self-test, the first self-test to gain WHO pre-qualification, which is currently used in around 95 countries in the world. His experience spans most disciplines of laboratory diagnostics, supplying testing solutions ranging from large-scale automated laboratory diagnostic systems to single-use rapid self-tests. Thank you for joining us here today, Brian. I also would like to invite and welcome Mr. Geoffrey Tassi, who is a public health and HIV prevention specialist, currently working at the AIDS Control Division of the Ministry of Health in Uganda. Mr. Tassi has experience spanning 15 years. His roles include the HIV testing services policy and strategy, coordination and capacity building, strategic information, research, and innovations. He has steered the policy reviews and the adaptations of optimized differentiated HIV testing services in Uganda. He has authored and co-authored 29 peer-reviewed publications in renowned journals. He has championed the introduction of HIV self-testing in Uganda for both the public and the private sector. Tassi is passionate about innovation and implementation science to improve health outcomes. He sits on 10 national technical working groups, including the National Self-Care Expert Group and 4 global technical working groups. A warm welcome to all our panelists. So let's dive into the questions, which is really the gist of this webinar. And I'm going to pose a question to all the panelists and invite them to respond to this first question. What role do you think the private sector can play in advancing self-care products as part of a universal health coverage plan?
Shall I go ahead, Sarah?
Yes, please.
Okay, so I believe the private sector has a vital role to play. Healthcare professionals and services are under severe pressure to be able to deliver quality healthcare globally. And in fact, just recently in October, our Minister of Health delivered a speech where he stated that the healthcare worker shortage is threatening the quality and sustainability of health systems in Africa and worldwide. Now, as countries strive to achieve universal health coverage, it is absolutely apparent that we need to embrace every single resource that is available. And I believe the private sector has capacity and a willingness to adapt to the new models of care, especially as we move away from the old curative models to a more preventative and self-care type modeling. Now, in this new model, healthcare professionals need to be able to educate and empower individuals to take more responsibility for their own well-being. And pharmacy, being one of the most accessible healthcare resources, is ideally positioned to support people with regard to self-care, advising on treatments for things like minor ailments, and supplying the variety of different self-care products and services out there. Thanks.
Thank you, Jackie. Would you like to weigh in, Brian or Geoffrey?
Hello. Hi. Hello. Sorry. It's Brian here. My apologies for my technical challenges this morning. Hopefully you can hear me okay.
Yes, we can hear you.
Okay, thank you. Yeah, thank you for the question. I personally, I think the private sector has a huge role to play in developing more personal care, if you like. And in fact, it's already occurring in many countries and was significantly enhanced by or during the COVID crisis. I think private health companies are now well versed in interacting with the public in terms of collecting information, sending collectors or tests, and receiving samples. After analysis, sending results out to individuals and also to government bodies. So I think that is well developed. And one thing I noticed as I travel around the world is that after COVID, these private organizations are expanding to a more comprehensive healthcare package, usually driven by technology and a comprehensive lab service. From a diagnostic standpoint, and our standpoint, OraSure's experience has largely been in the self-testing space, making simple to use, non-invasive tests for people to use in the privacy of their own home or wherever they want to test. And that's both in the public sector and in the consumer space. Currently, our products are the OraQuick HIV self-test, and IntelliScope COVID antigen self-test, which are very simple to use tests. And you could imagine are expanding that into a range of simple diagnostic tests for other disease states designed primarily for consumer personal use. Some diseases, for example, sexually transmitted infections, rapid tests don't work. And the next route for self-care, I think, is self-sampling. We do have, through our subsidiary company, DNA Genetech, we do have self-sampling options for different types of tests, but that's a very different service provision. But still, self-sampling devices have to be fit for purpose. They have to be packaged and labeled appropriately. And there has to be a mechanism to get that sample back to the lab quickly to retain the integrity of the sample. And I would assume some software needs to be in place to get the results back to the individual so that they could build that health profile. So I think the products and services to create this sort of universal personal health coverage do exist, both in the private and in the public space, perhaps mainly in high income countries. I think in low and middle income countries, certainly in the near term, the public health system continues to play a critical role in providing that central service and coordinating services with the private sector as and when needed. This interaction between public and private sector providers, I think, is going to be key as this whole thing develops.
Thank you, Brian. And both you and Jackie just underscore that indeed the private sector has a role to play, not only in bridging gaps, positioning products, making sure products are available, but also then they have a critical role when we also think about the need for coordination between the public and the private sector. One of our panelists, Mr. Geoffrey Tassi, is going to be joining shortly. And so we will continue.
Sarah, just to say that Geoffrey is now on the line.
Okay, great. Welcome, Geoffrey. Would you like to give us your view on what role the private sector can play in advancing self-care products as part of a universal health coverage plan? Hello.
Geoffrey, you are on mute.
Sorry. Sorry, yes. So apologies for joining in late. I've been trying to join with little success. Yeah, so I think I'll speak in relation to Uganda, especially the role of the private sector in terms of advancing self-care. So for Uganda, one of the things we know is that over 50% of the population actually does access care from the private sector. And for us, that is a very huge implication when it comes to care generally, but also when it comes to self-care. But also we do have many people, especially here in Africa, people like the over-the-counter pickup, of health products. So self-care brings in another dynamic of, people being able to access care at their convenience, even at community level, and affordable at an affordable price. So to me, the private sector, like I said, about 60% of Ugandans actually do access care from the private sector. So the private sector reaches more people than the public sector. And what that means that they are more close to the people. Almost the split is half-half, and therefore they are such a big partner that one cannot ignore when it comes to self-care. But also the other thing is that people do believe, they do believe in their healthcare providers, especially those that are closest to them. And the private sector comes with that kind of arrangement, because we have those small clinics, drug shops in the communities, deep in the community, that people simply run to for care. So the private sector comes in as a game changer, especially in advancing, in expanding, in scaling up self-care to reach the populations that we want to reach. Yeah. And of course, one of the other things that we have quite a variety of products in the private sector in most countries, which are not even in the public sector. And that's one kind of partnership that we need to have with the private sector, so that all the products, all the medical devices that go through to the private sector are actually approved, are of quality to protect the consumers. So I see a very good opportunity for us, government, to partner with the private sector to protect both the consumer, but also to stop the counterfeits, especially, which also affects the private sector business. So we are protecting the consumer, but it's also an advantage for the private sector. Yes. Yeah. Thanks, Sarah.
Thank you very much, Geoffrey. I think you've added a very critical point about the complementarity of the private sector, and indeed pointing out that for the case of Uganda, it actually reaches the majority of the consumers providing greater choice, and also opening up access. Coming off from your point around the pharmacies and the whole issue around the need to have controls so that there's quality products within the private sector, my next question is directed to Jackie. Private pharmacies play an essential role in people receiving access to health products. Do you see any challenges related to availability of self-care products in private pharmacies? And if so, what is the primary challenge, and how do we overcome that as a community?
Yeah, thank you very much, Sarah. Indeed, yes, they play a very big role in terms of having the products reach the people. But like I did mention, one of the threats that we see, especially here, I'm not sure how the other countries are finding this, but one of the threats that we have a lot of cheap products that are actually not approved. The prices are so cheap, they are so low compared to the approval products. An example is HIV self-testing, for example. So Uganda have about 4 approved test kits that are WHO pre-qualified, but also have been evaluated in country and approved by the National Drug Authority and the Ministry of Health. But beside those, then you have so many others that are not yet, that are not actually anywhere on the WHO list. Neither has Uganda approved them, but they find themselves, they just find their way into the country through our porous borders. So one of the challenges is actually that. So the private providers, the pharmacies and clinics, are finding a challenge in stocking the approved products because they are way expensive compared to the cheap products from everywhere. So what we are trying to do as government, working with the National Drug Authority, is to strengthen the component of regulation, but also to make it easy for the approved products to be registered here. Because previously it was taking about 6 months, and now within 3 months, you can have your product fully registered in Uganda, and you can access the market. So we want to make sure that the environment, the regulatory environment, is favorable for the players, the private players who want to access the market with the approved products. And also we are working with the Revenue Authority, the National Bureau of Standards, and other stakeholders to ensure that we stop the poor quality, the non-approved products from coming in here. The other thing we've tried to do is to work with the manufacturers, especially OraSure for self-testing, to ensure that the private sector also enjoys the subsidy that the Bill Gates Foundation had extended to the governments in sub-Saharan Africa, because at first the kits were way too expensive. And our belief is that, whether you access from the private sector or public sector, you are actually Ugandan and you're benefiting from this self-care commodity. So we are looking at the regulation, but we are looking at also price, we are looking at increasing choices, and we are looking at assuring that there is quality, both in the private and in the public sector, the quality assured products. Yeah.
Thank you very much, Mr. Geoffrey. Jackie, I will still turn this question back to you. I think Geoffrey has spoken to us a lot about the context in Uganda and more specifically around HIV self-testing. He notes the big challenge around the non-pre-qualified kits, the pricing of the cheaper prices around the unapproved kits, as well as reduction of the registration process timelines and maybe the cost associated, some of the challenges and also ways of overcoming some of these challenges. I'd like to turn over this question to you so that you can speak to us a little bit more from your experience. What do you see as some of the additional challenges related to availability of self-care products that could be broader than just HIV self-testing? And What do you think is the primary challenge and how do we overcome that?
Okay, thanks very much. Thanks, Jeffrey, for answering my question as well. So, Sarah, I think speaking as well to HIV self-testing kits, some of the challenges we had in South Africa were that a lot of the professional kits were being sold as self-testing kits, which of course they are not. They are not user-friendly, and you could end up with incorrect results, especially false positives. So I think the main challenge we had with the self-testing, the HIV self-screening test kits was price. They were too expensive, which is why the market got flooded with the professional kits. So you can get a professional kit for 10 Rand, but the self-testing kits were over 200 Rand. And so I know PSI has been doing a lot of work at bringing those prices down. We absolutely need to make them affordable. Otherwise, even if the pharmacies have them, they're not accessible to the people. But I think one of the main challenges that we have in South Africa is when we need task shifting. So there are a lot of products that are on the WHO list of possible self-care products, which are scheduled in South Africa. And so as pharmacists, we don't have access to those. And examples here are your medicines for termination of pregnancy, our PrEP and first-line ARVs, and even our oral contraceptives. Now, we do here in South Africa have, through our statutory council, we can do supplementary training, which gives us access to these higher scheduled medicines, which means that we can then assist people to self-care with these particular products. Now, the biggest challenge we're having at the moment, we were initiating something called pharmacist-initiated management of antiretroviral therapy, which was a follow-on from NIMART, which is the nurse-initiated management of ART. Now, NIMART has been extremely successful in South Africa. I think we all know that South Africa's got the largest treatment program for HIV or people living with HIV. And about 80% of people living with HIV in South Africa are actually managed by nurses. So this was a very successful case of task shifting. And pharmacists got training, but then we were blocked by several GP groupings who felt that it was the scope of a general practitioner and not the scope of a pharmacist. So I think some of the challenges we have is we need more advocacy to be able to increase this. I think the whole idea of pharmacists, for instance, being able to do PEP and PrEP was that they are difficult to reach populations. The men and young women don't tend to go into the clinics and they don't go and visit doctors, but they do come into pharmacies. I mean, we see here in South Africa, in the private sector, about 100,000 emergency contraceptive scripts filled every month. That means we're seeing a man and a young woman who are at risk of HIV and that we could be talking to about PrEP. But the problem is that we don't have access to these particular medicines. So, as I say, I think the primary challenge is access to these medicines from a pharmacy perspective. Access to training, if there is political will to allow this task shifting. So we need a lot more advocacy work and we need support from our Minister of Health. Thanks.
Thank you so much. I think very well articulated. And they sound like, you know, there's a lot of work around the policy level and operating environment that we need to work on that will also gain with a lot of support in terms of advocacy. I'm going to turn the next question to Brian. And Brian, you bring a wealth of experience in product development. Please describe how the different aspects of your product development cycle are impacted by the fact that your product is meant for self-care or self-administration.
Thank you. It's quite an interesting story, actually. If I could take the HIV self-test as an example. We actually started our development of the HIV self-test in around 2006, 2007, really to try and change the mindset around reaching those people who are not engaging with the healthcare provision. And I think the fact that HIV was beginning to be considered no longer a death sentence kind of relaxed some people's attitudes towards testing for HIV. We did have a test designed for clinical use, for use with both blood and oral fluid, the OraQuick HIV test. But the oral fluid non-invasiveness was really ideal for the consumer. We did get US FDA approval for the OraQuick in-home HIV test in 2012, and that required a huge amount of clinical work and lobbying to change the opinion. But I think that acceptance by the US FDA really was pivotal in changing attitudes around the world. We were also fortunate as we began to develop a product for outside the US in being involved in the STAR program, which was really groundbreaking in setting HIV self-test policy in low and middle income countries and actually helping us really identify what an HIV self-test or any self-test would look like. We knew, sorry,
go ahead. Had you finished? I'm sorry.
No, I was just going to say we had a product that we knew performed well, but we had to develop the packaging, the instructions for use. People who are going to use a self-test need to be able to understand the instructions, and we had to develop different translations, many different languages, to get a product that people could actually interact with and use correctly. We needed to perform clinical studies with laypersons. We hadn't had to do that before for our clinical use products. So essentially, we had to design a consumer product, still observing appropriate regulatory guidelines and our own stringent quality requirements, and that comes up when you think about other products. And also how we got the product to the population that needed it, whether it be through public health or through pharmacies. Pharmacies has a key role, as was mentioned earlier. They play a key role as advisors and in training and interacting with the public. So we had to get more involved with the pharmacists. And finally, just the marketing of the product is very different. We have to begin to interact with consumers, which typically we're not very good at in the diagnostic space, but even using our words, like we would use sensitivity and specificity, for example, that doesn't resonate with the public. So we had that whole learning process to go through.
Great, thank you for outlining for us, the process that it took and the different aspects, which really boil down to what I can hear you saying, consumer-powered care. How do you facilitate self-care and self-administration, and that really impacted on how you're thinking about the product, for example, the translations around the instructions for use, and also the engagement with the pharmacy, who is really the provider that is facing the client, especially the client that comes into the private sector. I will shift the next question to Mr. Geoffrey Tassi. Uganda is a leader in the self-care movement. In Uganda, how is the Ministry of Health working with or partnering with the private sector on this aspect of self-care products? And may you please outline for us some strong examples of the public-private sector partnerships in Uganda that we could all learn from?
Thank you very much, Sarah. Yeah, so in Uganda, one of the things we are trying to do is to standardize, of course, having self-care as a standardized additional care intervention on top of the other existing provider care interventions or professional services provided by the healthcare providers. So want to standardize this. And I'm glad to say that we have actually been developing our national self-care guidelines, and we've made sure that the interests of the private sector are really taken care of as we develop the guidelines. So we have our first draft of guidelines, which we just piloted, and we're just going to the field to pick more data, and in another round of supervision, we want to make sure that by the time we launch the self-care guidelines, we are almost certain that everyone is really, really well taken care of, and that all that could be issues and barriers to care, to self-care, are actually addressed. So we want to have a standard that works for everyone, both in the private and public sector. And to us, that is a very, very big milestone in the history of self-care in Uganda. The number two, like I mentioned, the other thing we are working on is the public-private partnership. So at the Ministry of Health, we have a desk for public-private partnership coordination. So already there are players, there are distributors, there are organizations that have memorandum of understanding with the Ministry of Health in terms of collaboration for both professional and self-care. Usually MOUs stand for 3 years, 2-3 years. So in that kind of partnership, everyone's expectation, especially from the side of government and then the side of the private providers, private sector player, are well defined to ensure that self-care, or to ensure that care in the private sector is not just looking at profits, but is also looking at the public health good, the public health outcomes of a particular intervention. Of course, there are issues around measuring the contribution of the private sector, especially be it self-care, be it professional care, the contribution of the private sector to public health interventions. For example, talk about the HIV response, talk about malaria, talk about other epidemics like TB. There are questions on how to measure the contribution of that. But once you and of course we are trying to develop, to do pilots, and I'm glad that South Africa also tried out the pharmacy model for ARVs. We are doing that here as well, and I think we are in the scale-up phase to work with pharmacies and see people can access ARVs. And the same thing, the same model is being used for HIV self-testing with the STAR3 project to avail our government's kits through the private sector. And there's a streamlined way of how people can access them through there. So there's quite a lot happening. Recently, we just had another interesting contribution from the private sector, from one of the partners. We had a training gap, and we spoke to one of the distributors if they could support training, because providers were not trained in some regions, and the demand for the products was actually quite low. They did through our public-private partnership. They did this. For World AIDS Day, we are also working with another distributor to have self-testing run in universities across the country, universities around the city. I think about 6 universities are going to benefit from this, and that is corporate social responsibility, the private sector. So they are going to give us self-test kits. We take them, the university students, 2 weeks preceding the World AIDS Day. We hope to reach about 5,000 university students. The kits are all provided by the distributors. So these are examples of how government can work with the private sector to advance self-care, to ensure that people do access self-care, they do utilize, but also contributes to the bigger public health outcomes, and also ending these huge public health challenges like HIV, TB, malaria, and also the unmet need for family planning. Yeah.
Thank you so much, Mr. Tassi. I want you to keep in mind from this conversation, just going off the points that you have given, in my next few questions, I'm going to be asking you to share with us what works, what makes these public-private partnerships in Uganda possible. So think about it and be ready just to share with us some key nuggets. What should other countries do to be able to replicate this kind of strong public-private partnerships that you have in Uganda for service delivery? And I'm going to now ask the next question to Brian. Given your expertise in self-care diagnostics, do you have lessons learned in successfully scaling up the sales and distribution of your self-care tests, especially in LMICs, that can be applied to other self-care products? We always have this big question around preparing for scale, especially when you think about the private sector, because it's quite different when you think about the public sector. So I'm looking forward to hearing if you have any lessons that you could share with us in terms of scaling up. Thank you.
Thank you. We actually learned a huge amount with the experience we've had from our OraQuick HIV self-test. And in fairness, we've been able to use that experience to quickly develop our IntelliSwab COVID antigen self-test and bring that to market. So I think looking forward, in general, we're better positioned to consider things like product design, the regulatory landscape. What do we need to do for different countries in order to get our product into the marketplace, and also the mode of distribution. And when you mentioned the private sector, it's, do we sell through pharmacies? We've had some experience in distributing a product through vending machines, which is another interesting mode of delivery. But you touched on it earlier. There's also this willingness to pay, and that I think is key. And certainly, as we develop the HIV self-test space, we kind of gained our experience as we went through it, as sounds fairly obvious, but at least we can now sit back and say, okay, if we're going to go into the market with a new marker, what is this going to look like? And I think that we'll benefit from that. I think overall, our lessons, users who are going to engage with a self-test or a self-care product of some description need to have confidence in that product, and they need to easily interact with it. So I think simplicity is really, really important. I mentioned the instructions in different languages, and I think we've got about 60 different iterations now. That builds credibility, and I think the more confident people are in using a product, they're more likely to use it and continue to use it and advise other people that they should be using it. One thing we did find, and I think Jackie touched on it earlier on, when people are empowered to use, in our case, a diagnostic test or a healthcare product, they tend to want to know more about it rather than just relying on a counselor or a clinician. So we have to provide more information that's written in language that people can understand on what we're testing for and why it's working and so on and so forth. And that was probably something we didn't realize right at the beginning, but I think it's quite important. In terms of just the manufacturing, the one thing is clear is, yes, we've got different language iterations, we've got different product put-ups for different countries. Countries want hotline numbers printed on the instructions or on the package. They want special messages put on the outside of the pack. that's incredibly challenging in terms of logistics, in terms of manufacturing process, and in terms of cost. And I think that's something that, as a manufacturer, we've got to get better at, because it does impact cost, and there's very different from the sort of traditional clinical use diagnostic product. Going back, if I may, just for 1 second, going back to this quality thing and confidence in the result, it was mentioned by both Jackie and Jeffrey, the sale of non-regulated, not even self-tests, cheaply through commercial outlets, pharmacies and the like, really has to be clamped down on, because that, I'm very passionate about that. I think with all the building that we've done over the years to get to this stage with self-care, these sort of products can seriously undermine all the good work that's been done to date. So there's a lot of things. I mentioned engaging with the pharmacists earlier on. That is a very, very important vector, if you like, to get the product to the people. They are seen with trust in the community. And I think that we've got to engage with them more to make sure they're aware of the product, they understand more about the product such that they can give advice. And of course, we spoke about price earlier. The pharmacist is responsible for the end price to the consumer. And we've been fortunate that in a number of countries we've been able to work with the pharmaceuticals or the pharmacy society, to at least set a reasonable price to the end user, such that there's not huge margins being loaded on to healthcare products at pharmacies. And I think that's really, really important. And that's why the whole expectation of affordability right from the start is really important for any manufacturer. Thank you.
Thank you so much, Brian. And thank you for sharing the good in terms of what leads to a successful scale up, but also pointing us to the biggest kind of risk when we think about scaling up self-care products, which is really the regulatory environment. From our experience, we have seen that as we create demand for pre-qualified products or quality assured products, the demand for non-pre-qualified products also then goes up, because then pricing and availability becomes an issue. And from the WHO guidelines, it is clear that, when we talk about self-care, we really must be clear around availing a quality product or a quality service and ensuring that that service actually provides for accuracy. And so I just want to put that the biggest challenge, I think, to scaling up self-care products and self-care services is going to be that regulatory environment that really clamps down on non-quality assured products and also non-quality assured services. And on that note, I'd like to ask Jackie a similar question, but with a view on pharmacies. What do you see as the incentives for private pharmacies to support scale up of self-care products? Especially when we think about what Brian has just outlined, that the pharmacist is ultimately responsible for the price to the end user. Yeah, and price is a sensitive issue when you come to a client who wants to purchase in the private sector, and they would often use price as a factor of choice.
Absolutely. And yes, I hear exactly what Brian is saying there. However, in South Africa, certainly selling or dispensing through pharmacies is highly regulated. And in fact, we have a maximum fee, which is stipulated by our statutory council through a pricing committee. So you don't get these sort of extortionary high prices. Saying that, I think for us, for private pharmacies, I think there's so much more that we can do in promoting self-care. And I believe that the incentive is there. A lot of, as I've said to you before, some of the barriers for us is access to some of these self-care products, be that other healthcare professionals guarding their scopes of practice or affordability. But I think as well, a great incentive for private care pharmacies would be access to state patients. So here in South Africa, we've got a two-tier health system, unfortunately. We have about 9 million insured people who purchase their medicines funded by medical schemes through private hospitals and pharmacies. And then we have 51 million people who either self-fund or have to go to state facilities. And our state facilities are under huge pressure to try and be able to look after the vast majority of the population of South Africa. And interestingly enough, it's about the same resources in the private sector and the public sector. So we've got this complete skewing. So there is ability and capacity in the private sector to help a lot more. And I think a great incentive for us to be able to empower uninsured people, to educate them, to get them medically literate would be to give us access to these patients. So setting up public-private partnerships, allowing us to access state medicines, and they would all be with service level agreements, so prices would be agreed upon, almost as you say, a universal health coverage. And I think this would be a huge incentive for pharmacies. But aside from that, it's access to some of these self-care products that we currently don't have access to. And that requires supplementary training, perhaps permitting, to expand our scope of practice so that we can do, and as I mentioned before, termination of pregnancy, PrEP, PEP, first-line ARVs, family planning, injectable and oral, just to name a few. And I mean, just those services alone. We do have some public-private partnerships with provincial departments of health, and they have been extremely successful. And I think we need to roll out more of those. Thanks.
Thank you so much, Jackie. I'm going to put you on the spot for just 1 minute. When you talk about access to products and access to patients, and you talk about the incentive around accessing the state products, how do you see this working? Because in a few countries, what I've heard, the hesitancy is around, then how will the private pharmacies make money? Because there's the markup on the products, or maybe people will need to pay for consultation services. How do you think this would work? And of course, I'm realizing that, you know, South Africa is sort of our model when we talk about public-private partnerships and, you know, incentives around the private pharmacies.
Absolutely. And so what I'll do is I will base this on my experience. So in the Western Cape, in the early 1990s, we rolled out a public-private partnership. Was that pharmacists did training. We got permits to be able to supply contraceptives, and we acquired the state oral contraceptives and injectables at no cost, and we passed those on at no cost, but they did not pay for our services. So what we did was we paid a small consultation fee. So as an uninsured person, you could come to, for instance, my pharmacy. I would be able to give you oral contraceptives or the depots, and I would charge you a small consultation fee, almost like a convenience fee. And Sarah, what I can tell you is that within a year, I had 2,000 state patients. The convenience of being able to just walk into a pharmacy, maybe at lunchtime in their lunch break, get their injection, pay 50 Rand and walk out. It was absolutely worth it. And we must remember that accessing state services is not free. People have to take time off work because the queues are so long. They have to catch a taxi to these facilities and catch a taxi back. And in fact, a survey was done here in South Africa that to access free medicine actually costs about 230 Rand. So as a pharmacist, I was charging 50 Rand to do family planning, and that was a bargain. And I had so many state patients, and it was a great incentive for us. We had people walking into the pharmacy who would buy other things as well. And it really started this relationship building with the state patients. So as I say, that was a success here in South Africa, but it has not happened in all of the provinces. Thanks.
Thank you so much for sharing that and for, you know, trying to demonstrate to us how incentives can be achieved for the private pharmacies to support the scale up of self-care products. I'm then going to shift gears a little bit to Brian to talk to us a little bit about in-country relationships and partnerships. From your experience, what are these relationships and partnerships in country that are key for manufacturers of self-care products? And do you have any suggestions on how manufacturers can strengthen these relationships? Of course, you've really talked a bit about the regulatory landscape, which is extremely critical when you talk about entry of products in any country. But are there additional relationships? And do you have any suggestions on how this can be strengthened?
Thanks. Yeah, I think relationships at all levels is really our experience. Regulatory landscape, of course, that's something that continues to challenge us because every country has slightly different requirements, even although any product has to be WHO pre-qualified. Once you get it WHO pre-qualified, you then have to go through the registration process in each country, and often evaluations are needed, and that tends to prolong the launch of any product in country. I think the public health provider, the central public health provider, is key to the provision of the care in terms not only in setting policy, but ensuring that in the public space where people are accessing perhaps tests provided by the public sector through pharmacies, the product has to be available where and when the people need them, and that's often a logistic challenge. But nevertheless, it's really important. We have found situations where our product going into country has sat in a warehouse for months and is not actually being moved down to the provinces and the various remote centres that we can help where we can in actually getting that moving. But that's important, and also because, again, from a manufacturer standpoint, because self-care products, whether they be self-tests, self-sampling products, or other, they tend to be country-specific in terms of language and how they're printed. So the supply chain is really important. If we don't have forecasting, if we don't have sight of the need in country, then you begin to run the risk of stock out. And I think that sort of relationship to try and see the runway of product supply in country is really, really important. I mentioned earlier the relationships with pharmacies, pharmacists, and pharmacy society is again another important relationship, so that we can ensure that when people go to pharmacies and try and access a product, that the pharmacist can advise them correctly on how the product should be used, some of the limitations perhaps, and act as a go-to point if that individual needs more information. Pricing we mentioned as well. The other thing that is quite interesting, and we're finding we're getting more and more involved in, is how we get that message out to the consumer that the product is available at certain pickup points, because you can get a product into a pharmacy or into a warehouse, but if individuals don't know how to access it or where to access it, then it's not really going to move. And partnerships with implementing groups and advocacy groups are actually key, I think, in the distribution of product and the dissemination of information, because it can build an understanding of with the kind of key population on how the product or service can be accessed. And they're able to communicate with our network in a language that resonates, something that's perhaps difficult for us to do. And we have partnered with a number of advocacy groups and NGOs to help get that message out about the importance of self-care and the importance of engaging with the health system, which, let's face it, many people, if they're feeling healthy, don't really do. So I think the whole process needs to be joined up. There's no point in raising awareness if the product supply isn't there and the product isn't into facility. So the whole thing needs to be joined up, that ongoing dialogue. And we try to do that personally in country. I have people in a number of countries, but also we have a lot of local commercial partners to keep that dialogue ongoing, so that we can ensure the product's available when people want to access it. Thank you.
Thank you so much. I just want to take on from the point where you've talked about you need to join up awareness with the product supply and thinking about this consumer-powered, consumer-centered care that we're talking about when we think about self-care. And just direct the next question to Jackie, because we want to talk about consumers and the groups. Just in a nutshell, who is the consumer that is accessing self-care products through the pharmacies? And are there others that we would like to serve through the pharmacies? And are those others there in the community that are currently not being served? Are there groups and populations that we think could actually benefit from accessing self-care products through pharmacies or through the private sector, but aren't currently doing that, Jackie? And in your view, how do we access them in terms of awareness, in terms of use, in terms of even linkage?
Okay, so I think, as I've already mentioned, in the private pharmacies, we certainly service the insured, the 9 million insured people, and then the self-paying or the cash-paying people. And there are many uninsured people who pay for pharmacy services out of their pocket. Who would we like to see there? Obviously, we would like a much broader, more equitable system out there. And it was interesting what Brian was saying there about marketing and what pharmacies can do. So say, for instance, I say to you that we give out about 100,000 emergency contraceptives every month. And it's an opportunity, you know, to say to somebody who needs this, do you know your status? And if they don't, here's a self-testing kit. You can take it home in the privacy of your own home. Here's one for your partner. Go and test yourself. And so you create the demand for these products. But as I was saying, I'd like to see a lot more equity so that we don't just serve those that can afford it, but that we could service anybody and everybody. And I think there is a huge market out there. I think once people realize that they can actually do things for themselves, there is an incentive to do more. So say, for instance, you say to somebody, here's a self-screening test kit. Take it home and use it, or take another one, give it to somebody else. These are all examples. And I know that when I travel in Uber quite often, and I will very often say to my Uber driver, did you know that there's a tablet to prevent HIV? And how many people don't even know that there is a tablet? They've never heard of PrEP. And so there's this huge market where people could be getting involved in self-care, but they don't know where to get it. So I think as well, what one of my colleagues was saying earlier is we need to engage with a lot more advocacy in getting it out there. Thanks, Sarah.
Thank you so much. So my last question to the panelists before we turn over to the questions from the audience goes to Mr. Tassi. I think between yourself, Jackie, and Brian, it all is going to boil down to some form of coordination, leadership, support, and just to go back to a previous conversation around partnerships. Would you share with us 2 or 3 things that make private-public partnerships engagements possible that we should be looking out for and potentially replicate in other countries?
Yeah, thank you very much, Sarah. So like I had mentioned earlier, I think the very first thing is, like I did say, for you to have the environment, a conducive environment for the private sector to be able to be part of self-care is very, very important. And when I talk about the environment, of course, we have issues. We have issues like things like the policies. What are your policies like for the country? We are moving to for self-care, you know. For example, we have different distribution channels. You have digital platforms, We have online pharmacy. We are actually in Uganda going to also try out accessing self-test kits in the supermarkets. Yeah, just like condoms. So once your policy provides a conducive environment for the players to participate and to be able to avail the self-care products without any barriers, then that's already a very big achievement for the private sector. So what are the policies like for the different countries? Yeah, can they allow, for example, these self-care products to be accessed in the non-medical settings, non-pharmacy settings, like a supermarket for self-test kits, for example? We have for the last many years been working with community health village teams. I would call them community extension health workers. And these guys, we give them malaria RDTs, we give them anti-malarials to be able to, for example, take down to the community. Now, under self-care, we also have other people called health entrepreneurs. Now, these are private practitioners. It's more like a community mobile pharmacy, I should say. Yeah. So it's about, number one, the policy of the country to address the environment. Okay. And the environment, the other issue about the environment, conducive environment, is the regulation. I already said that Uganda, we've been able to work with the authorities, National Drug Authority, to be able to bring the approval process period from 6 months to have a commodity registered to 3 months. That is 50%. Then under leadership and governance, of course, but also participation and ownership, we have a national HIV self-testing task team that's for self-testing. And what we did was to co-opt members of the private sector to be represented. We have to make sure that there is a representation of the private sector on that national technical working group, so that their contribution, their challenges, their frustrations, their achievements are also shared to be able to ensure that we all move smoothly, advancing care for Ugandans. The other thing, of course, I did mention the issue of resources there in the chat window. So someone was asking about information, was asking about counseling and linkage to care, for example, for those who test positive. So one of the things we share across some of the resources, we have a national toll-free line for HIV self-testing that people can be able to use at any time. This is toll-free, it's 24 hours. It's supported by the government and partners, but everyone can use it, both private and public sector. The number is printed on the pack for the self-test and also on the eSat. Then we also have other platforms such as digital apps where people can access information. The other thing, of course, about the environment, I think we already talked about that, having regulation of the approved products and the unapproved ones, ensuring that there's regulation and enforcement to take out the unapproved products. Then, of course, the supply chain issues for the public sector. What's the supply chain for the public sector of these self-care commodities is streamlined, then you will not have a lot of problems, especially to see your commodities are linked to the private sector, as well as the packaging. We were very clear at the beginning to tell Orasure to have a different pack for the private sector and a different pack for the public sector, so that we are partners, we are complementing each other, and also to avoid abuse of our public sector commodities. And then finally, I think the other thing is look at the private sector as equal partners in healthcare, rather than just looking at them as profit moguls, but having that partnership and also having them access information. When we develop guidelines, we develop policies, we develop SOPs, they should be shared across the public and private sector so that they are able to give information. For example, I just typed here in the chat window, information around care and treatment for HIV, information around prevention services such as PrEP, VMMC, condoms, PEP, and the others, so that they are not just sellers of self-care products, but they can link clients, they can link people to the other services, especially in the public sector. Yeah, so I think for me that's how I can summarize it. Make them part of the TWGs, work on the environment, but have constant dialogue, because each time we have meetings here, monthly, quarterly, and we keep reviewing our performance, we address the challenges, and each one takes up action points that they're supposed to act on, and that's how I've kept improving. Yeah.
Thank you so much, Geoffrey, for sharing those great lessons on how to make the partnership work, indeed by regarding the private sector as an equal partner. And thank you to our panelists. You have actually given us fantastic lessons from different perspectives based on the discussions that we've just had. I'm going to field a few questions from our audience, and I'm going to direct the first question to Jackie. There's a question from our participants. How do we ensure that pharmacists respond to people's needs and don't impose harmful gender and other social norms? How do we even out the power between pharmacists and the clients?
So if I'm understanding the question correctly, there is some fear that the pharmacists are not going to act appropriately. So, and I was also listening to what Geoffrey was saying there. And, you know, I think if we're looking at any public-private partnerships, it's so incredibly important that there are good agreements in place, so service level agreements, so that we know exactly the roles and responsibilities. Because exactly what you're saying, there isn't trust. The private sector thinks the government, the state sector is corrupt, and the state sector thinks that the private sector is only out to make profit, where at the end of the day, actually, we all are interested in the health care of the people of the country. As far as the power of the individual going into a pharmacy, so if they did come across any instances where they were not treated with the respect that they deserve, certainly in South Africa, our South African Pharmacy Council has got a very efficient complaint system that can be raised there. Every pharmacist has a code of conduct that we have to respect. And I would hope that if you have experienced that it really is the minority. The average pharmacist out there really deeply cares for the health of our patients and our clients. Thank you.
Thank you so much, Jackie. The next question is to Brian. From your perspective, what advocacy is most needed on self-care national policies to support sales of self-care products?
Sorry, just unmute myself. I think the problem that we see generally is that people don't engage with healthcare providers when they don't feel unwell. And in a number of disease states, this is an issue because by the time people do feel unwell, they're usually quite unwell and they do need significant help. The advocacy we're looking for is really to just raise awareness in the need, certainly in certain infectious diseases, the need for people to test when they don't feel unwell. And it was quite interesting. I took part in, for example, in a workshop in South Africa, arranged by Higher Health and Final Mile, and we were talking and focusing on the HIV situation with young women, and this group had run a survey on a number of adolescent girls and young women on what were the things that concerned them most, and this is in the country with the highest HIV burden, and yet HIV didn't appear at all. Well, I think it was about number 14 on the things that they were concerned. They were concerned with the relationships and all sorts of stuff, as normal young girls would be. And it kind of brings the point home that people don't generally think about testing. Hepatitis C in particular is another burdensome disease state that people just don't test for. So I think that the more we can advocate for people to actually just take time out of their daily lives and test for infectious diseases that they may not consider that they're susceptible to or they have, I think is really, really important. Cancer screening is another one. People just need to engage, and it's universal. They just need to engage with health services and test themselves where they get the opportunity, because at the end of the day, it could save their life.
Thank you. Thank you so much, Brian. What you're pointing out is that there's so many aspects that we need to continue to advocate on. And so you've given us a whole array of so many other aspects of self-care that we need to be talking about. I want to thank you all. There were so many great questions in the chat. Unfortunately, we don't have time to go through all of the questions. We put a link to the new SCTG frequently asked question tool in the chat box that answers many of these tough questions. We'll also make sure to capture these questions from this meeting and share them with our panelists and consider them for future panel discussions. So bear with us. You had great questions. We will be able to answer them in the frequently asked question tool for future discussions. Next slide, please. I'd like to thank all of our panelists for sharing their experiences and lessons learned, and also thank each one of you for spending the last 1.5 hours listening to us and sharing your thoughts, engaging, and also answering questions in this important dialogue on the role of the private sector in advancing self-care. We all know that you're busy and really appreciate you taking time out of your schedule to hear from our panelists on the experiences and thoughts on how the private sector can help to advance self-care. I would also like to make a quick plug for the SCTG. The power is in its members. And I'd like to encourage those of you who are not members yet to consider signing up to become a member. The same is true for the RHSC and our Market Development Approaches Working Group. We've dropped the site for you to learn more about both groups and the forms to become members in the chatbot. That way you can hear about our work and future activities to keep this work moving on. I want to thank you so much for being part and parcel of this webinar. And I want to wish all of you a great rest of your day. Thank you so much.
Thank you, everyone. Cheers, Sarah.
Thanks, Sarah. Appreciate the chance to be part of the webinar.